Good afternoon, everyone. I want to welcome you to our Tuesday press briefing with updates on COVID-19. As of this morning, we've lost over 100 citizens in our community. Please join me in a moment of silence for the lives we've lost and for the families they leave behind. Thank you. Now we will hear updates from our community leaders, and first we'll hear from City of Albany Mayor Bo Durham. Mr. Mayor.
Thank you, Chief. Good afternoon. I would like to address a few issues this afternoon. First, many people who are out and about are not wearing masks. I've been contacted by citizens who inform me they have been to large retail stores where other customers are not complying with our request that everyone wear face coverings when in public. We repeat that request today. Please, please wear a cloth face covering or some other mask when in public. This is inexpensive and very easy. For those who do not have access to masks, the city has received a generous donation from Procter & Gamble and will be distributing these masks at various locations in the coming days. We also recommend that all stores request, if they are unwilling to require, that customers wear face coverings when shopping in those stores. Second, I have received complaints that staff at some fast food restaurants are not wearing gloves. This is not an option, as wearing gloves is a requirement for anyone in the food service industry. Please be advised that local law enforcement will be responding to reports that employees of restaurants are not complying with the guidelines promulgated by Governor Kemp. Third, as you will hear from other speakers today, the National Guard testing site is now operational. Specimens are being collected at the 100 block of Mercer Avenue behind the Civic Center. There are no criteria, which means everyone can be tested. The National Guard has encouraged the public to utilize the app to schedule an appointment, though this is not required. The testing site will be open from 2 p.m. to 6 p.m. 7 days a week until further notice. A swab will be placed into the nostril and then delivered to the state lab for testing. We expect to have the results back within 48 hours. Individuals who have concerns that they may have contracted the virus after being tested may be retested 7 days after the first test. We are extremely fortunate to have the testing site here in Albany, and I would ask that all citizens take advantage of this opportunity. You do not have to be a resident of Albany or Dougherty County to be tested. Again, it would be preferable for you to schedule an appointment utilizing the app. This will allow the National Guard to better operate the site and will reduce your wait time. Fourth, we are seeing positive trends here in Albany. The number of COVID patients at Phoebe Putney Memorial Hospital fell below 100 last week for the first time since March 22nd and continues to decline. Please continue to maintain social distance, wash your hands with soap and hot water repeatedly throughout the day, remain in your residence unless there is a necessity to leave your home, in which event you should wear a mask, and return to your residence as soon as your business is completed. We know that the state was reopened, even though the guidelines set forth by the White House, which call for the lifting of restrictions upon businesses only following a downward trajectory over a period of 14 days, either in the number of new cases or the percentage of positive cases, were not satisfied. I'm familiar with objections to these measures, as a statewide opening can ignore the fact that the virus is actually spreading in certain areas of a state. Also, a 14-day decline is not sufficient in hotspots, where the rate of infection and number of people who are hospitalized remains exceedingly high. For this reason, the City Commission passed a resolution on Friday, April 24th, requesting that businesses not reopen at this time. Most of you are now aware a group of local restaurant owners met last week and decided they would not resume in-house dining until the local medical community concludes they can do so without jeopardizing the health of their customers and employees. I applaud these ladies and gentlemen and encourage other businesses to follow this example. I need a haircut. My wife and I frequent restaurants several times a week. People who own restaurants and those who work at those restaurants are counted among our friends. I want to return to PT Gym, not so much to ride the stationary bike or walk on the treadmill or lift weights. I want to see my friends, like Burke Wagner. I want to make sure some of the older members are well. I want to attend church and sit in the back pew where I have sat for almost 30 years. Fortunately, most churches have been having services online, but this is not the same as seeing dear friends and loved ones, many of whom are senior citizens. I want to be in church to see people who were my friends before I became mayor and who will be my friends long after I hold any office. Today, I ask you again to please continue to exercise the precautions you have heard repeatedly so that we can safely return to the barber, to the beauty shop, to restaurants, gyms, and houses of worship. We do, however, now know that everything will be different for some time and that we will be required to modify our routines and behaviors to protect ourselves, those we love, and our fellow citizens. Thank you.
Thank you, Mr. Mayor, for your remarks today. We will now hear comments from Dougherty County Commission Chair, Mr. Christopher Colinas. Mr. Chairman.
Thank you, Chief. Thank you, Mayor. As always, I want to begin by offering my sincere condolences and heartfelt sympathy to each of the families, the more than 100 families that have lost loved ones. We continue each day to suffer losses in this community at the same time that we're also growing stronger in this community. Those are complicated emotions to process. These are complicated times as we continue to progress, but also at the same time that we continue to lose citizens. I want to focus for a bit. First, let me say this. I want to thank my fellow commissioners, the Dougherty County Commissioners, for their hard work. I also want to acknowledge the City Commission and the hard work that the Mayor and his City Commissioners have performed, as well as the Dougherty County Commissioners, in making sure that we educate the public. And I said this at our last press conference. Just because you are allowed to do something doesn't mean that you have to do it. Just because you're allowed to open a certain business or to engage in a certain activity does not mean that you have to do that. Right now, we are seeing a lot of people in our community that are making very educated decisions. We saw a restaurant community come together and make decisions about whether or not it would be viable or reasonable for them to open their restaurants. And many of those restaurants have chosen not to open up for dine-in services. And the reason is this. It doesn't feel right now. We have been working very hard, and if we could please pull the slide back up for the data that we had, please. Thank you. We've been working very hard in this community on trying to finish a very difficult drill. And this started some time ago, but we took swift and decisive action in this community before almost any other community in the entire state of Georgia. And we're now seeing the numbers at Phoebe Putney Memorial Hospital, which services counties around this region. We're seeing those numbers flatten. We're actually seeing the number of people on ventilators go down. The number of people that are in the hospital as a result of COVID-19 go down. I think approximately 2 weeks ago, we had about 127 COVID-19 patients at Phoebe Putney Memorial Hospital here in Albany. Now we have 80. One is too many. but 80 is far more manageable than where we were at. We have to continue to exercise personal decisions. People can spend their energy debating about policy or this or that, but ultimately, the decisions we make as individuals and as community members determine whether or not this virus continues to spread and whether or not we will be able to beat the grip of the coronavirus off of this community so that we emerge stronger and faster than many of the other communities around the state that are just now starting to realize the full impact of COVID-19. We have many resources that have come here, frankly, and not to many other communities. It is a huge deal that we have the National Guard here performing en masse testing to our citizens. That is at the 100 block of Mercer Avenue over there next to the Civic Center, 7 days a week from 2 p.m. to 6 p.m. And let me say this. This is a resource that has not been made available to many other communities. It is completely free. And I want to explain the importance for us to utilize this resource. It is important from a data perspective because many people may have and likely have the virus that will never know it. If you have the time and you have it is literally a contribution to this community for you to go get tested, irrespective of whether or not you believe or don't believe that you have the symptoms. It is a data point that allows researchers, people at the at Augusta University, allows our healthcare professionals to analyze exactly how much it has proliferated, how much it has gripped our community. And that determines, in many times, what additional resources you do or do not get. We know that the testing that has been provided thus far has been provided typically to people that are only symptomatic. But we know from the information that we've been provided by the scientists and the epidemiologists that many people walking around today, every single day, have the virus but never know it. And those people are capable of spreading it to many other people, some of which will become symptomatic, some of which will not become symptomatic. And so it's very important for us, as we communicate our story to the state, to the federal level, and as we continue to ask for more resources, as we continue to advocate for more help, for us to make sure that as many people get tested as possible. Completely agree with the mayor. When you're out in the public, mask up. One of the things we're also working on is seeing if we can get masks distributed at that National Guard site. We have not worked out those details yet, but we are working on a strategy to get masks to people in the community that do not have access to masks. Wearing a mask just makes good sense. It helps prevent you from spreading germs to other people and potentially prevents other people from spreading germs to you. And if both people are wearing a mask that are in proximity, and you shouldn't be any closer than 6 feet apart, then that is a helpful thing. That's a helpful tool. Very helpful. As Mayor mentioned, you can call the hotline or visit the Augusta University testing website. You can call the number at 706-721-1852 or visit augustahealth.org/COVID-19. There's also an app available for your phone by searching AU Health Express Care in the App Store. I want to repeat that. AU Health Express Care in the App Store. Please get tested. It is important. And I will say this, in my experience, when resources are provided during a time of crisis, if those resources are not utilized, they will go to another community. And I would rather us have lines of people in a safe environment. It's a safe place. These are National Guard trained folks. The Department of Public Health is working with them Augusta State University is working there as well. This is a safe environment to get tested and to get information. The turnaround time is reported to be a day to a day and a half to perhaps 2 days on getting test results. It's very important information, and I would just encourage everyone, please make use of this resource because it may not be here if we do not utilize it. And if we can utilize it to mass test our community, that provides us with such a better view of what our road to recovery is, and also will serve to confirm what we know, which is that what we've been doing thus far has been working. The governor mentioned yesterday the unveiling of a new COVID-19 dashboard on the Georgia Department of Public Health's website, which offers interactive reports that track emerging indicators, rates of growth, and outcomes of interventions. Geomapping capabilities also help to support the state's efforts to identify and address emerging hotspots. We're not an emerging hotspot, we are a hotspot. As well as allowing decision makers to evaluate multiple scenarios to identify vulnerable populations such as healthcare workers, the medically fragile, and communities with at-risk populations. And I'm going to say this, one of the things that I have directly advocated for, and I'll say this, each region is different, each community is different. We have unique circumstances in Albany and Dougherty County that are more unique than in many other places in the state of Georgia. And one of the things that I have requested through the advisory committee that I serve on, as well as to members of the governor's team, is to form regional task forces that can help shape future decisions so that certain regions are treated differently than other regions. And I certainly hope that that is a message that is heard so that our community can mold or at least influence policy that hopefully shapes how we emerge. But irrespective of what happens on a policy side, what I've been very proud of and very thankful for is the responsiveness of our business community, the absolute responsiveness of our faith-based community. And I really want to thank our faith-based community for working hard, irrespective of the fact that they have the capability to potentially open up and have live services with people. They have chosen to do online services because they know that it doesn't feel right at this time for us to have gatherings of people. That is a huge thing, and I'm very thankful for our community and how strong our people are. And I'm also thankful for some of the people that have started to open businesses and that are operating. They are doing it in a very reasonable fashion. They're wearing PPEs, they're wearing gloves, they're for the most part, people are doing the right things. And this is going to be a learning process as we sort of start embarking upon what it may look like to become closer to where we were. We're just not there yet. Additionally, by April 29th, as an additional update, we expect to have an additional 29 rooms with a minimum of 15 new ICU rooms. Again, we do thank the governor for his team making many of these investments available to us, not only for the benefit of Dougherty County, but for Southwest Georgia, for making the National Guard available to us and making those advancements at Phoebe North available to us as well. And as a reminder, the governor's shelter-in-place order will continue to remain in effect through April 30th, with encouragement to the medically fragile and elderly to continue to shelter in their place until at least May 13th. That being said, I will say this. Please continue to mask up, make smart decisions, and just because you can do something doesn't mean that you have to. Thank you.
Thank you, Mr. Chairman. I'd like to ask to come forward now for some remarks the Lee County Board of Commissioners, Chairman Mr. Billy Mathis.
I'd like to talk today about personal responsibility. Both of the speakers before me mentioned that the numbers have been better of late. They've been certainly better in our community. We've had some days with the number of 0 new cases, which is fabulous, but the numbers have been in the low single digits recently, and that's good. But with businesses reopening this week, and I'm sure more every week after this week, it's important that the citizens continue to do what we've been doing. Personal responsibility, especially now, is vitally important. Continue to wear your masks in public, continue to social distance, continue to wash your hands and do all those things we've been doing. As I said, with businesses reopening, many of them are doing so in a way that they feel is responsible for each business, but it's incumbent upon the public to continue doing what we've been doing. We've had a few deaths recently in the Lee County community, and we pray for those families. But it's important for us to remember that to avoid any future deaths, especially in the nursing homes and those kinds of places, that we continue to shelter the people in the nursing homes, we continue to shelter our elderly. We've done that in my family with my mother and my in-laws, but it's absolutely incumbent upon the public to continue to do those things. That's all I need to say today, is to just please, no matter what you do, continue to do all of those things that we've been doing with the new developments of businesses opening. Thank you.
Thank you, Chairman Mathis. We will now have an update from Phoebe Putney Memorial Hospital. The Chief Medical Officer, Dr. Steve Kitchen, here for some remarks. Dr. Kitchen.
Thanks so much, Chief. And I'll go ahead and provide our report and update. And I'm happy to report that we recently have seen some very encouraging trends occur not only at Phoebe Putney in Albany, but across our health system at Phoebe Sumter and Phoebe Worth as well. And I'll refer to the slides that you should be able to view. So to date, we've had 2,266 patients who have tested positive for COVID-19. We presently have 93 patients who are in the hospital at Phoebe Putney in Albany, Phoebe Sumter, and at Phoebe Worth, hospitalized with COVID-19. And regrettably, we now have had over 100 deaths, 101 deaths that have occurred across our health system. We've had almost 7,000 patients and individuals who have been tested for COVID-19. And fortunately, and this is one of the favorable trends, what we're finding is that the rate of transmission, the number of new positive tests each day, continues to go down. So over the last 24 hours, we had 8 patients who tested positive and 81 patients who tested negative for COVID-19. And one of the curves, the graph that has the green line that goes down, shows that the percentage of patients who are testing positive each day has continued to go down over the last few weeks. I think the most encouraging trends that we see, and again, if you look at the slide that has the red line that goes down, that shows how many patients are hospitalized every day with COVID-19, that number has declined significantly over the last two weeks. The latter part of March and the early part of April, we were having over 40 patients a day who were being hospitalized across our health system with COVID-19. That number has steadily declined over the last 2 weeks, and now, at least the last few days, we have been down in single digits with less than 10 people who have been hospitalized with COVID-19. The last graph, which is the one that's labeled cumulative positive cases, this again shows that the rate of new cases in our community has begun to flatten out. So although we are still seeing positive cases, and I will tell you, there is still plenty of community transmission that is occurring at this time. What we're seeing is that the rate of new cases has begun to flatten out. And when you hear the term flattening of the curve, that is what is being demonstrated in that graph that says cumulative positive cases. I want to tell you that these favorable trends have only occurred as a result of the courageous measures that your public officials have taken in our community to curb the rate of transmission. And what I mean by that is those measures such as social distancing, shelter in place, wearing a mask, that is what is resulting in the favorable trends that we now see. So my request to you today is, regardless of whether we technically have a shelter in place and whether businesses have reopened, my request of you today is to continue to practice those measures that have been so effective the last few weeks, because it's these acts of personal responsibility that have allowed Albany and our surrounding communities to realize a decrease in the rate of transmission of COVID-19. And, you know, I'm by nature a pretty cautious individual. I don't tend to be a risk taker. And although we have certainly seen favorable trends, I think we've seen far too much suffering, far too much death, far too much heartache, far too many extinguished dreams and disappointments to risk the chances of another surge of COVID-19 occurring in our community. And that's why my petition to the community at large is to continue to practice those measures that have been so effective in helping us curb the rate of transmission of COVID-19. I fully appreciate the fact that what I'm asking is, does it come without difficulty and without personal sacrifice and responsibility? We are social beings. We long for those personal interactions with family, with loved ones, with friends. And the power of the human touch, we know, is such a powerful emotion. We long to embrace a simple touch on the shoulder, those measures which are just part of conveying our feelings and emotions. But I will tell you that it's the it's the social distancing measures that we have put in place, again, that are allowing us to really see progress in this battle against COVID-19. We have to appreciate and understand that this is a highly, highly infectious and communicable disease, and that it's transmitted via close personal contact and via contact with infected surfaces. You know, initially we thought that the risk of people who had no symptoms, that the likelihood of them transmitting the virus to others was relatively low. This is what we call asymptomatic transmission, when we have an individual who really has none of the symptoms of COVID-19 being contagious and being able to transmit it unknowingly to other people. Unfortunately, this has been shown not to be the case. In fact, there was a recent medical article that was released in the New England Journal, which shows that actually asymptomatic transmission can, in a group that they had, over 50% of patients had no symptoms at the time they tested positive for COVID-19, and that just speaks to why we need to continue to practice the measures that we put in place. And so my final ask is for everyone to practice 5 tips that should be evident on the slide. First and foremost, wear a face mask at all times when you are out in public. As we have discussed, the primary mode of transmission is via respiratory droplets. And by wearing a mask, you tremendously reduce the chances of transmission of the virus occurring. It also protects you as well. Secondly, wash your hands frequently with soap and warm water, and use a hand sanitizer often. Third, avoid touching your eyes, nose, and mouth. We know the virus can be easily transmitted when it comes in contact with your mouth, your nose, your eyes, that sort of thing. So please avoid touching your eyes, nose, and mouth unless you have thoroughly washed your hands. As we've talked about, do not congregate in groups. Always maintain a distance of at least 6 feet from others when you are in public. And lastly, clean and disinfect frequently touched objects and surfaces often. So again, I'm very pleased to report the favorable trends that we've seen. I'm also pleased to report that our clinical outcomes of patients across our hospitals, we're also beginning to see improved results, and that is, I tell you, solely attributable to the tireless efforts of our physicians, our nurses, all those other frontline caregivers as well. And I think if we can continue to do this, we will ultimately prevail in the battle against COVID-19. So thank you.
Thank you, Dr. Kitchen, for your remarks and comments and updates from Phoebe Putnam Memorial Hospital. We will now hear from the Director of the Southwest Georgia District of the Department of Public Health, Dr. Charles Lewis.
I'd like to start by saying that I think we all owe a great debt of gratitude to all of our first responders, including emergency medical personnel and law enforcement and many others. We also owe a debt of gratitude, I believe, to all healthcare personnel, not limited to, but including doctors, nurses, therapists, laboratory workers, x-ray technicians. And among that group, I would also include public health workers. Throughout the 14-county health district, we have many dedicated healthcare workers who have worked long hours, who have worked under stressful conditions, and like most healthcare workers, who have actually put their own health on the line by serving their community, and they're proud to do it. So a lot has been said about testing, but we really can't say enough. Testing is available really 7 days a week. It's an easy thing to do. And in public health, throughout our health district, we have 3 different locations, including Dougherty County, Thomas County, and Mitchell County. It's easy to schedule an appointment. The telephone number is posted, 229-352-6567. Appointments can be scheduled 6 days a week, Monday through Saturday, and that's all day long. The testing hours, or I should say the collection hours, actually differ just a little bit from the hours that you can call and make an appointment. The collection hours are Monday through Friday, 8:30 in the morning until 5 p.m., and then on Saturday morning from 9 a.m. to noon. So we do have a generous list of criteria that will make a person eligible for testing, and it starts with the symptoms, and at the bottom of the slide we list the common symptoms that are associated with COVID-19, including fever, cough, shortness of breath, chills, muscle pain, headache, sore throat, and a loss of taste or smell. So those are the symptoms that would make a person eligible. But beyond symptoms, first responders or healthcare workers of any kind are eligible. If a person is 60 years of age or older, or if a person provides care for someone who is 60 or older, they would be eligible. If a person has an immune compromising condition, or if they care for someone that has an immune compromised condition, they would be eligible. People with serious chronic conditions such as kidney disease, diabetes, severe heart disease, lung conditions, and morbid obesity would also qualify. People who live or work in a congregate setting, and then people who need to have testing done to return to work. Those are all eligible to have testing done. We have 3 locations and 1 telephone number to call. If you call that number, it would be your option as to whether you are tested in Thomas, Mitchell, or Dougherty County. So once a person has a positive test, they can expect a telephone call from public health. In fact, you may get more than 1 phone call. The first phone call is what we consider to be a contact investigation. People from the public health department will call people who've tested positive, and we want to investigate your situation. We're going to want to know when your symptoms began, if you had symptoms at all, and we're going to want to know who has been in your presence. We'll want to go back to 2 days before your symptoms began, and we're going to ask about anyone who might have been within 6 feet of you for 10 minutes or more. And that's very important for the health of the community. We need to know who is at risk because of being exposed to someone that's positive. So we'll take down the names and hopefully contact information of everyone who has been in your presence. And we're not trying to be nosy. We're not going to share this information with anyone outside of the healthcare field, and it's just to help us to know who we need to call. So that next step is what we call contact tracing. Once we obtain the list of people who have been put at risk, then we will reach out and contact those folks to to let them know, if they don't know already, that they have been at risk and that they need to quarantine for a period of time. If we can accomplish this, then those who are sick already hopefully will stay at home and won't spread the germs. And then those who have already been put at risk can quarantine to see whether or not they will develop symptoms. And during that period of time, if they do, and if we're quarantining correctly at home, then we're not likely to spread the germ any further. So these are very important steps. If you've been tested, please ensure that your telephone is close by, is charged up, and if the phone rings, please don't ignore it. It could very well be public health calling with some very important information. It's very important to continue to practice social distancing, and it's also very important, if you are sick, do not go to work, stay home, contact a healthcare professional, have a discussion, and let the professional help you decide whether you need to be tested or to just shelter in place. Public health is a proud partner in the community's fight against this COVID-19 pandemic. Thank you very much.
Thank you, Dr. Ruiz. We will now hear updates from our Dougherty County Coroner, Mr. Michael Fowler.
Good evening. I'm gonna give you a breakdown of what these stacks that we have so far. I want to piggyback on everything that the mayor, chairman, and different ones have said. Let's follow the orders so we can live. At this present time, the stacks is we have 114 deaths in Dougherty County, positive death from residents in Dougherty County. 3 ones in the northwest side, 31721, we have 12 deaths. 31707, we have 25 deaths. East Albany, we have 25. And the south side have gone up to 52 deaths. We have a total of 62 females, and we have a total of 52 males. We have 1 Latino, we have 26 white, and we have 87 black, based on race. Based on race and gender, we have 1 Latino male, we have 19 white females, we have 7 white males, we have 43 black females, and we have 44 black males. Based on age, in the age of 30, we have 2 in the age of 30, we have 7 in the age of 40, we have 6 in the age of 50, we have 36 in the age of 60, we have 31 in the age of 70, we have 80, in the 80s we have 22, and we have 10 in the age of 90. And the average age now have gone up to 72. Location by death, we have 91 that have died in one of the hospitals. We have 18 have died in the nursing home. We have 5 that died in the residence. Nursing home residents that have died, we have a total of 33 and 81 outside of the nursing home. Again, we have a total of 114 death residents in Dougherty County. Thank you.
Thank you, Mr. Fowler, for your remarks. We'll open up now for questions. Several of our speakers are still here. Are there any questions today? Okay. As we end today, let us continue our social distancing and shelter in place throughout our community. Although it may not feel like it's working, it is slowing down this virus little by little. And let's not falter in our efforts to do everything we possibly can to mitigate the impact of this virus on our community. Everything we do, whether large or small, helps, and we must remain vigilant in doing our part. Let's keep fighting. Mask up, Albany. Mask up, Dougherty County. Thank you all for being here today, and we'll see you again on Thursday at 1 p.m. That ends our press briefing